This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Ferinject 1000 injection is an essential treatment for iron deficiency anemia. It's administered to replenish iron levels in the body. Indications and uses. This injection is primarily used to manage iron deficiency anemia in adults and children above 14 years. It is particularly beneficial for those who cannot tolerate oral iron supplements or require immediate iron replacement due to certain medical conditions such as chronic kidney disease or other related health issues. It is crucial to consult a healthcare provider for proper diagnosis and treatment options. How it works. Ferinject 1000 injection works by releasing iron from its complex, which aids in hemoglobin synthesis and increases red blood cell production. Directions for use. The injection is administered intravenously by a qualified healthcare professional. The dosage and duration depend on individual factors like age, body weight, and the severity of the iron deficiency. It is essential to follow the doctor's recommendations closely to ensure effective treatment. Possible side effects. Possible side effects may include headache, dizziness, flushing, high blood pressure, nausea, and reactions at the injection site. It's crucial to consult a healthcare provider if any side effects worsen. Precautions and warnings. Before receiving treatment, it's vital to inform your doctor if you are pregnant, breastfeeding, have liver or kidney issues, or are allergic to any of the components. Monitoring during treatment is essential, especially for elderly patients and those with chronic health conditions. FAQs. 1. What is the use of this injection? It is used to treat iron deficiency anemia. 2. How long does it take to see improvement? Some may notice improvement in days, while it may take weeks for others. 3. Are there any common side effects? Yes, including headache and nausea. 4. Can it be used in pregnancy? Use is only recommended if clearly necessary. 5. Should I inform my doctor about other medications? Yes, disclose all medications, including supplements. Thank you for watching. If you have any questions or suggestions, please leave a comment below. Your feedback is invaluable.